Hello, everybody. Dr. Tanya Clark here with Outpatient Mobile Solutions. Today, what I'd like to talk to you about is pulmonary and respiratory health. Now, I am an occupational therapist by training. However, I have found that there are several techniques that really work to help to promote that pulmonary health. So, for things like COPD or right now the coronavirus, this is really helpful to promote that respiratory health for people. So hopefully you will be able to practice this with me, and if you ever need to, you can utilize these tools yourself. So the first part of what we're going to do today is practice a proper inhale and exhale. So when we inhale, we take all of the oxygen that's in the air and we bring it into our lungs, and it goes into the lung tissue, has a little exchange with carbon dioxide, and then we exhale the carbon dioxide. So what we want to try to do is we want to try to maximize the oxygen and then the excretion of the carbon dioxide. So inhaling and exhaling are really very important pieces, and we're going to talk about them separately. So in order to get a proper inhale, what I want you to try to do is, and this is going to be more like a stretching inhale. So what you're going to do is you're going to inhale all the way to the bottom of what your lung capacity is. And then I want you to take 3 extra sips of air. So this is how I always talk to my patients about it. And if you give yourself that extra thought of taking a sip of air, it's going to give you that ability to stretch your lungs out a little bit. And if you do it properly, you will probably cause yourself to cough. So I'm very sure I will cause myself to cough this evening. So go ahead and try it with me. We're going to take a full breath. And then you're going to exhale. Excuse me. So when you exhale all the air all at once. So again, you're taking all your air in, filling your lung space, taking 3 extra sips of air, and then expelling it all in one shot. So what you can do is you can use that to start getting a more effective cough, if that's helpful for you. But primarily, I like to use that as a tool for people to learn what their full lung capacity is. A lot of people don't know how much air their lungs can actually take. And if you have any kind of pulmonary illnesses, likely your lungs will be taut, and it'll be a little bit sore right at the bottom of your diaphragm. So doing this is okay. It's good to do, and it will help to promote that, again, pulmonary or that lung health. So of course, if you do any of the exercises that I do with you today and it causes you severe pain, please call your doctor immediately. And if it's something that you'd like to work on, certainly feel free to reach out to Outpatient Mobile Solutions and we can continue to work on it with you independently. So again, let's do the inhale with the 3 sips. So we're going to breathe in. Okay. So I don't know if you've been able to watch what my stomach's doing, my abdomen. So when I'm breathing in, I want you to really think about allowing those lungs to go down towards your belly button. So if you can think about breathing to your belly button, that's great. There is a certain kind of singing that I have been taught about. It's called bel canto singing. So everybody who's heard of bel canto, good on you. It's a great technique to help to promote pelvic floor health, and it's also great for pulmonary and respiratory health. So with bel canto singing, what you do is you literally think about singing all the way into your lower abdomen or your pelvic floor. So I'm not going to push you that far today. That might be another video. But today, what I want you to really think about is filling the lungs to capacity, 3 extra sips as low as you can towards your belly button, allowing your stomach to come out while you breathe, and then excreting all that oxygen, pushing it all back out. So part 2 is exhaling. So when we exhale, we want to make sure that as much as we can get out gets out. So in order to do that, you want to think about a 4-2 ratio. So if you're breathing in for a count of 2, you're going to breathe out for a count of 4. So you're going to do double whatever you take in. And this is a great technique that most therapists already know about. But if you haven't talked to a physical therapist or an occupational therapist or even a respiratory therapist about this, you can try it for your own benefit. So what that would look like is just breathing in. And if you can, I recommend breathing in through your nose for those 2 counts and then out your mouth for the 4. Now, if you've got a cold and you can't breathe through your nose, of course, it's better to do it through your mouth so then you can actually get the benefit. So let's do it through the nose if we can. We're going to breathe in, out, and again. So what you're doing is you're pacing your breath. You're pacing your inhale and you're pacing your exhale. Now, when you do that exhale, we are trying to clear our lungs of all the carbon dioxide. So we're really trying to empty our lungs of as much carbon dioxide as we can so that we can, when we take in that next breath, fill up and optimize the amount of oxygen that our body is actually benefiting with. So that's part number 2. Part number 3 in your respiratory health for today is a productive cough. So what I find is really helpful is thinking about that full breath, that belly breath, taking a full belly breath in and then exhaling it all at once in a cough. And you want it to be as deep as you can. The deeper, the better. And if you think about trying to clear the different parts of your lungs, you might have to do this a couple times in order to get that depth of your cough. But the more productive we can make this cough, the better you're going to feel. So what you're going to do is you're going to take a deep breath in. Again, if you can through the nose, awesome. If you have to do it through the mouth, fine, do that too. And then you're going to exhale all at once in a cough. And please, please, please cough into your elbow. So when I'm coughing right here. And if I need to, I can go a little bit higher, but I am probably going to miss the mark. So if you go more for the elbow, that's going to be optimal for you. So again, breath in. Get that little rattle. That's what we want. So I am recovering from a respiratory illness, which is why this video is so important for me tonight. So I appreciate you helping me to get my respiratory exercise in. Let's go again. And we're going to breathe in and then exhale all at once yet again. So we're going to do in. So again, I'm trying to push all my air out when I do that. I do feel a little bit of a, maybe a little tinge, not quite discomfort, but almost like a stretch or a push. And that's right at my diaphragm. So my diaphragm is right about here. If we go from the side, pardon me. So my ribs go down to here, okay? Ribs start opening up here. My diaphragm is right here, okay? So that's where you should be feeling the most of this work. So again, try these on your own. I hope that you feel a little bit of movement in your chest cavity right now. Hopefully your lungs feel a little bit worked. That's what we want. You don't want to do this too many times. A couple times, 2 or 3 times for each of these is plenty for right now. Now, if you wanted to do this maybe twice a day, that might be appropriate, but certainly for everybody's condition and status, it's going to be a little bit different. So if you have any question whether or not you should be doing this, shouldn't be doing this, if you should be doing repetitions, certainly reach out to a medical professional and get some advice that's specific to your needs. But again, I appreciate everybody being here with me this evening. Thank you again for giving me my respiratory exercise for the night, and I look forward to seeing you again soon. Thank you very much. Have a great evening.